unfolding. Well, what are the reforms under discussion? You've been studying these, I know, but let me just quickly recount them. Universal coverage. Within the House Ways and Means Health Subcommittee, we are looking at, that means employer provide or employers pay into a fund that does subsidize individual purchase of coverage, so employer pay or play, and an individual mandate. Now, President Obama did not campaign on the notion of an individual mandate, but seems to send signals that an individual mandate would be acceptable provided there are sufficient subsidies so that the premiums would be affordable under that provision. Another major thrust of health reform, access to insurance guaranteed. I'm the only former insurance commissioner in the House of Representatives, and these issues have long been talked about: guaranteed issue, community rating, and some kind of minimum coverage standard that reflecting about the average of the health insurance policies out there to date. An important feature of House legislation is the insurance exchange option. What this would provide would be insurance opportunities where an individual employer could have his employees, rather than just select a single policy provided by the employer, shop within the exchange from a variety of competitive options. And what is emerging as a very controversial element of early House considerations, a public plan option within the options in the insurance exchange. So you could pick something from the Blues, you could pick something from Aetna, or you could pick something like the federal employees have, ultimately underwritten by a new government entity providing that coverage. Also an important area of discussion, delivery system reforms, with bundled reimbursement ideas to address care delivery fragmentation, notions you've, again, been hearing about, and much work needs to be done to refine exactly how these would apply, whether they're pilot status or more broadly implemented in reimbursement reforms. Medical home, accountable care organizations seeking greater integration between physicians and hospitals, bundling of post-acute care, or and trying to get at this notion that frequent readmits have become a significant cost component in Medicare, some kind of issue to either penalize readmission or bundle post-acute care to cut down on that post-discharge readmission event. Medicare reforms would also be part of the package. And the CHAMP Act last year advanced a few of them. You could look at ideas still percolating around that were not enacted: greater insurance coverage for preventive measures and increased help for low-income seniors to be part of a package. Now, where discussions on health reform have advanced less fully is in how we pay for it. The difficulty of this is going to be extraordinary and is going to, I believe, test all of us in terms of whether we can conclude a package or not. I put this one in the area of low-hanging fruit. Medicare Advantage plans take federal taxpayer dollars out of the Medicare system, put them into basically increased reimbursement for health insurers. We think Medicare costs ought to go for medical care, not insurance services. And so something that costs $1.12, $1.20 to administer $1's worth of services, we think, simply does not make sense in this environment. The cost savings from that are part of the financing package. Now, additionally, it gets harder. The President's budget recommended that for those over $250,000, there would be a change in the deductible percentage of charitable contributions, for an example. Already you've heard howls of protest from members of both parties on that one. And so the pay-fors are going to be extremely difficult, and I would say there is no clear outline yet.